Hello, my dear doctor. I'd like to have a very important case, my dear, especially for any of the exams and also in your clinical practice that I'd like to share. One of the important case, there is a DVT, it is a deep vein thrombosis, my dear. So the message is, if the people come up with the unilateral leg swelling or with the painful unilateral leg swelling, what I say, the painful unilateral leg swelling, so the diagnosis of deep vein thrombosis that we need to think about. Yes, not only the painful unilateral leg swelling, it can be the painful bilateral leg swelling as well. So the painful leg swelling, the first one that we need to exclude the diagnosis of the deep vein thrombosis. Yes, in her case, this lady presented to my clinical practice that she presented with the unilateral rather than unilateral, but the bilateral, but having some of the asymmetrical leg swelling, and she has a painful leg swelling also. So what I found the clinical findings and clinically that we suspected the diagnosis of the deep vein thrombosis. So the deep vein thrombosis clinical probability that we do based on the Wells scoring, and that Wells scoring starts that the active cancer, if the people having active cancer, and come up with the yes, the painful leg swelling is the diagnosis, of course, the DVT. So yes, Wells scoring depends on the active cancer, the one you get the score, and the paralysis, paresis, and plaster, or maybe the immobilization for more than 3 days, and also the recent surgery within the last 12 weeks. So these are the risk factors basically to develop the deep vein thrombosis. But the most important thing is the clinical findings of the DVT is really important. What you need to know that I should say that the PSOC marker. What does this PSOC really mean? The P4, the pain marker or tenderness, is very much important. The pain and tenderness. If you come close to me, let's focus on my hand. So if I just feel the cuff muscles, and she has got a really a painful, and this is really a tensed. So this is a pain or tenderness. And next is the swelling. You see the legs are swelling. You see the legs are swelling here. The legs are swelling. The both legs are swelling. So these both legs are swollen. This is important. So as I say, the painful, these are pain, and the cup muscles are pain. There is specific test can be done, but you shouldn't do in the real exams. So yes, this is the painful leg swelling, and also having some of the tenderness. If you feel the tenderness, and these are tenderness, and swelling, definitely the swelling. So as I say, the pain or tenderness. Second one is the swelling, and if the asymmetrical swelling, that you need to measure the mid level of the cup muscle, and if the unilateral leg swelling, in that case, the more than 3 centimeter, the leg swelling is more likely the sign of DVT. And yes, my dear, and sometimes the collateral vessels, you can see some of the collateral vessels can be seen in our case also. You see the legs are there. And most really, as I say, the PSOC. So the P for pain, S for swelling, and yes, of course, swollen legs or swollen cuff muscles are all together. And O for edema, my dear. Yes, this is important. You see, this is a pitting edema. If you pit it here, so you can see the pitting edema, my dear. Yes, and this is painful. You see, this is pitting edema. So you can see how the pits. And some of the collaterals. So what I say, the PSOC that you need to remember. So P for the pain or tenderness, S for swelling, and O for edema, with the pitting edema, and C for the collateral vessels. So the PSOC altogether will give the 111 marks, my dear. Means the points in Wells scoring. And putting all them together, if you found that the clinical probability is more than 2, the diagnosis, the likely diagnosis that you need to do the Doppler ultrasound scan, my dear. And it'll be great to know that this lady presented to me 1 week back, and we have done based on the suspected the DVT, and we have done the Doppler study, and this Doppler study came in our hands. The diagnosis, you see, the DVT involved the proximal anteriotibial vein of the both lower limbs. So yes, my dear, we have found this one, and we suspected this, and we started the treatment as well. The 1 week back, and today she came up with some of the follow-up, and it's been improving, and already improved after 1 week. So what is the message, my dear? Just look at me. The message is the Wells scoring. If the Wells scoring showed that, is showing that the point is more than 2. So the likely diagnosis in that case, that we should do the Doppler ultrasound scan, and you should start the treatment. The message, if the critical probability test means that all the P's form, the pain, swelling, and the O for edema, PSOC, yes, C for collaterals. If it is more than 2, then you need to do the Doppler ultrasound scan. You need to start the treatment and then doing the investigations altogether. And second important point, if it is less than 2, means the unlikely. In that case, then you do the D-dimer test. And D-dimer test is positive, then you can do the Doppler ultrasound. If it is negative, this is clinically unlikely the diagnosis of the DVT, and you can exclude the DVT. The message is the score is more than 2, the likely score is less than 2 is the unlikely. So if it is likely, you can start the treatment, along with that you do the Doppler ultrasound scan to confirm the diagnosis, and then it will direct you how long the treatment should be done. Yes, my dear doctor, listen very carefully. Diagnosing DVT and starting the treatment is not only the one. And the second important talks, my dear, is really important. You need to ask her regarding any chest pain, any shortness of breath, to exclude the diagnosis of pulmonary embolism. Yes, my dear, this is very much important. You need to ask her. Once again, they need to do the well scoring. Based on the scoring, then you need to ask and exclude the pulmonary embolism. If you suspect the pulmonary embolism, you need to make the diagnosis by doing the CTPA. Yes, my dear. Versus VQ scan. Yes, the CTPA is likely or more beneficial than doing any other test, my dear. So what I'm saying, the first important point that you need to make a diagnosis, clinical diagnosis based on the well scoring, and then start the treatment and the Doppler ultrasound scan. Second important point, to exclude the pulmonary embolism. And third important point, the underlying etiology of the deep vein thrombosis or the thrombotic tendency. With the females, then the bundle bags, the APH bundle bags, APH means the A bundle bags, I should say. So A for the APAS means the anti-phospholipid antibody syndrome. P for PNH means the peroxidal nocturnal hemoglobinuria, and H for homocystinuria. So the APH means the first A bundle bag, and the APH bundle bag should be excluded. Underlying etiology. Second A for next to the A is the B bundle bag with the Behçet's disease, the likely diagnosis in case of male Mediterranean descent. In that case, then you need to exclude the Behçet's disease. And C for mine is really important. C for cancer and C for chronic heart failure. These are really needed. So ABC bundle bags, the underlying etiology, you need to think about and you need to exclude them to get the underlying etiologies so that you can treat the patient for the underlying etiologies. So what is the message? Message is the first one, that you need to make your diagnosis based on the critical probability, and you should start the treatment concurrently. That you need to do the Doppler ultrasound scan, continue the treatment. Second important point, that you need to exclude the pulmonary embolism based on the well scoring. And third, that you need to work on the underlying etiologies like the ABC bundle bags, A for APH with the APAS, PNH, and ACU, and B for Behçet's syndrome and Behçet's disease, and C for cancer and congestive cardiac failure. I hope that, my dear, you have got the really a good message. Thank you very much. Thank you once again.